In the annals of American institutional suicide, the appointment of Robert F. Kennedy Jr. as Secretary of Health and Human Services stands as a monument to our collective determination to replace expertise with enthusiasm, science with superstition, and medicine with what can only be described as weaponized ignorance. Here is a man whose primary qualification for overseeing the nation's health is his surname, and whose understanding of medicine appears to have been gleaned from Facebook groups and fever dreams. Let us begin with the crown jewel of Kennedy's intellectual achievements, his decades-long crusade against vaccines, those miraculous interventions that have saved more lives than every doctor who ever lived combined. Kennedy has spent years claiming that vaccines cause autism, a theory so thoroughly debunked that even Andrew Wakefield, the disgraced fraud who started this whole murderous mythology, might tell him to tone it down. Yet here he sits, the man who thinks MMR shots are a conspiracy, now in charge of the CDC, FDA, and NIH. It's like making an arsonist the fire chief, except arsonists at least understand how fire works. The autism vaccine lie isn't just wrong, it's homicidally wrong. Every child who dies of measles because their parents listened to Kennedy's ravings is a victim of his narcissistic crusade against reality. He's turned childhood diseases that we had essentially conquered into comeback tours, bringing back the greatest hits of infant mortality like some demented nostalgia act. Polio, that great crippler of children, watches from the wings, waiting for its encore performance courtesy of Kennedy's war on immunization. But vaccines are merely the beginning of Kennedy's scientific illiteracy parade. This is a man who claimed that COVID-19 was ethnically targeted to spare Ashkenazi Jews and Chinese people, a conspiracy theory so baroque in its stupidity that even QAnon followers might suggest he seek help. He's promoted hydroxychloroquine, ivermectin, and virtually every pandemic snake oil except actual snake oil, though given time, he'll probably endorse that too. The irony, of course, is that Kennedy himself is fully vaccinated, a product of an era when his family still possessed functioning cerebral cortexes. He's protected from the diseases he's helping to spread, like a pyromaniac in a fireproof suit. His own immunity makes him feel safe to endanger everyone else's children, a moral position that would make Mengele blush. Consider his promotion of raw milk, that bacterial soup masquerading as a beverage. We pasteurize milk for the same reason we cook meat and treat water, because dying of preventable diseases is generally considered suboptimal. But Kennedy, with the confidence that only comes from profound ignorance, advocates for returning to the good old days when children died of listeriosis and bovine tuberculosis, slipping through dangerous policies under the guise of traditionalism. Let us not mince words, this is biological Russian roulette with a dairy product. His total ignorance of chemistry is equally impressive. He's claimed that endocrine disruptors in water supplies could be affecting children's sexual development and gender identity, taking a legitimate scientific concern about chemical pollutants and transforming it into conspiracy fodder about feminizing children. He opposes water fluoridation, apparently preferring that American children return to the British dental aesthetic of the 18th century. He exhibits a special kind of paranoia bequeathed only by ignorance, seeing conspiracies in condensation trails, toxins in vaccines that don't contain them, and plots where others see basic public health measures. The alternative medicine grift that Kennedy promotes is perhaps even more dangerous than his anti-vaccine evangelism. He's championed chelation therapy as an autism cure, based on his false belief that mercury in vaccines causes autism. Never mind that most vaccines never contained mercury, and those that did contained ethyl mercury, not the toxic methyl mercury, and even those have been reformulated. He's defended and promoted various alternative medicine practitioners who promise miracle cures for everything from cancer to COVID, always with the same pattern: attack the treatments that work while promoting expensive, unproven alternatives to desperate people. His advocacy for medical freedom reveals a profound misunderstanding of what freedom means in healthcare. The freedom to be conned by quacks is not liberty, it's abandonment. The freedom to die from preventable diseases is not choice, it's negligence. But Kennedy, from his position of wealth and privilege, romanticizes a return to natural healing that he himself would never endure if seriously ill. You can bet if he got cancer, he wouldn't be relying on vitamin C infusions and positive thinking. Speaking of worms, we must address the parasitic elephant in the room: Kennedy's own claim that a worm ate part of his brain. While this would explain much about his scientific understanding, it's more likely that the worm died of starvation, finding nothing of nutritional value in Kennedy's cranium. Still, if true, it means America has put someone with literal brain damage in charge of public health. Frankly speaking, the worm itself would probably make more evidence-based policy decisions than what's left of its host. His research method deserves special mention. Kennedy approaches scientific literature the way a drunk person approaches a buffet, grabbing whatever looks appealing, ignoring context, quality, source, or whether items go together. He'll cite a retracted study from 1998, a blog post from a naturopath, and a misinterpreted legitimate study as equally valid sources, creating a hodgepodge of spurious citations to back spurious claims. The actual scientists at the agencies he now oversees must be experiencing a unique form of professional torture. Imagine spending decades studying epidemiology, virology, or immunology, only to have your boss be someone who thinks Wi-Fi might cause cancer and that antidepressants are behind school shootings. It's like asking Mozart to take direction from someone who plays the kazoo badly, while insisting that musical notes are a government conspiracy. Kennedy's environmental work, the one area where he occasionally stumbled into correctness, has been completely abandoned in favor of his medical delusions. He went from fighting corporate pollution to becoming pollution himself, contaminating public discourse with ideas so toxic they require a hazmat team of fact-checkers to clean up. He traded defending rivers for attacking vaccines, proving that even a broken clock can decide to run backward. The nepotism that underlies his appointment deserves acknowledgement. His last name is Kennedy, and in America, that's apparently qualification enough to oversee 300 million people's health. His uncle was president, his father was attorney general, and he's someone who believes pharmaceutical companies are engaged in a massive conspiracy to poison children for profit. It's dynastic decline worthy of the late Roman Empire, except instead of appointing horses to the Senate, we're appointing conspiracy theorists to Health and Human Services. What makes Kennedy particularly dangerous isn't just his ignorance. America has survived ignorant officials before. It's his confidence in that ignorance. He doesn't know what he doesn't know, and what he doesn't know could fill the medical libraries he's never properly read. He's the Dunning-Kruger effect incarnate, so incompetent he can't recognize his own incompetence, so wrong he doesn't know what right looks like. His followers, bless their statistically shortened lives, treat him like a prophet revealing hidden truths about health that they don't want you to know. They, being doctors, scientists, researchers, and anyone with a functioning understanding of biology. It's a cult of manufactured victimhood, where being told that drinking raw milk is risky becomes persecution, and requiring vaccines for school becomes tyranny. The children who will die from preventable diseases during his tenure won't make headlines. They'll die quietly, individually, their deaths attributed to natural causes rather than to Kennedy's policies. The cancer patients who forego treatment for alternative therapies won't be tallied. The diabetics who try cinnamon instead of insulin won't be counted. Kennedy will create a hidden holocaust of preventable deaths, all while claiming to promote health freedom. This is what America has become, a nation so suspicious of expertise that it prefers confident ignorance, so distrustful of medicine that it embraces medical conspiracy theories, so confused about freedom that it thinks the freedom to die of measles is worth protecting. Kennedy isn't the disease. He's the symptom of a culture that has decided that knowing things is elitist and that opinions are equivalent to facts. We've appointed to the highest health office in the land a man who makes Dr. Oz look like Jonas Salk, who makes Gwyneth Paltrow's Goop seem peer-reviewed, who makes medieval bloodletting appear evidence-based in what can only be described as a wholesale abandonment of the Enlightenment, a return to an age where disease was caused by bad humors and treatment involved leeches and prayer. So here's to Secretary Kennedy, the worm-brained, vaccine-denying, raw milk-promoting, science-rejecting nepotism hire who now controls American health policy. May his tenure be as brief as the lives of children in the pre-vaccine era he wants to recreate. May his policies be as effective as the chelation therapy he promotes for autism, that is to say, not at all. And may America survive this experiment in replacing medicine with mythology, though given our track record, our prognosis is decidedly poor.